Good afternoon and welcome to COVID-19 School Reentry, Promoting Social and Emotional Wellness. I'm Ken Trump, President of National School Safety and Security Services in Cleveland, Ohio. And my colleague and friend, Dr. Scott Poland, is with us from Fort Lauderdale, Florida today and will be leading our presentation. This presentation today is part of a three-part webinar series for COVID-19 that we are offering to our friends and colleagues in the school community. Our first webinar was on operational and support services, reentry consideration, listing the various departments that you see, talking about the issues, considerations, and planning efforts that needs to go along with the academic side of the house, as well as the operational side. We're having a lot of conversations on academics today, but we also have to remember how's transportation going to run, and what about food services and nutrition, safety and security, operations, communications, human resources, and our facility staff and other important key players who are part of the overall reentry consideration. Our second webinar was on communicating effectively with school stakeholders in highly ambiguous and uncertain times. It reflected some of my work in the doctoral program that I'm in at Johns Hopkins University for my EDD, which is actually the focus of my dissertation, Superintendent and Principal Communications with Parents about School Safety in Highly Ambiguous and Uncertain Times. And today, those webinars are recorded and can be found on our website at schoolsecurity.org for those who'd like to go back and review those. Today, I'm honored to have my friend and colleague, Dr. Scott Poland, present his vast amount of experience and knowledge on resiliency and promoting social and emotional wellness. Scott is professor at Nova Southeastern University, has presented internationally as a resource at professional associations for educators, social workers, school psychologists, safety personnel, and administrators who are working on school climate, school culture, social, emotional, school psychology, suicide, and school safety issues. Scott also has a rich history in serving as a director of psychological services for a large school district in Texas for nearly 30 years, and consults frequently for school districts across the country and does expert witness work on issues of high-profile safety issues that are in litigation. So with that, I am going to toss over to Scott, let him start the introduction, and I'll work on sharing the screen. Scott?
Thank you very much, Ken, and I really appreciate working again with schoolsecurity.org, and I've always liked that you see the very broad perspective of everything necessary to keep kids safe, feeling good about their school, and progressing academically as well. So my great pleasure today is to talk about, in all honesty, what is something that is truly unprecedented in our country, and that students have now been out of school for several months. Every school is going to reopen at some point. We don't know exactly when that will be or how that might actually look, but the bottom line is that schools will reopen at some point. And what can we do to be ready? That really is the question. And I've tried to draw on my extensive background and responding to school tragedies, some of which have just been local, some have been of national scope with regards to terrorism and school shootings like Columbine and Parkland. And in general, I have one main thought. The wisest decisions in education are always made by a group of people. And what I really hope is that a lot of school administrators are listening in today, and they've already formed some kind of a task force or group to advise them on bringing kids back to school and really dealing with everybody's fear and anxiety. And we have to focus on what can we control. And it's really our reaction and following all of the guidelines that come, of course, from health officials. And administrators really need to welcome the input from kids, teachers, and parents about how is the best way to do this and what will help you feel safer. So I'm using this word calm, and the L really is for listening to input from a wealth of people about how can we bring everybody back together and follow all the medical advice, but also pay attention to their emotional needs and their fear and anxiety. And it's certainly a time for all the adults in kids' lives, whether it's the teacher, the principal, the parent, everybody to be modeling, we will get through this. We will manage this. So some key questions that I believe need to be asked. Some of these could be asked through a survey, or they could be asked of the task force, but what reactions might we expect? Obviously, lots of kids are going to be incredibly excited to come back, but all the staff may not be quite as excited. What reactions can we expect? What will help everyone feel safer? And what crises has your school already gone through? Something you could draw on, something that worked, something didn't work so well, and how can we do better next time? And every kid, every staff member has a story to tell about their experience of being quarantined. And I've done a number of more general presentations on helping children and families, and I hope having everybody at home actually brought everybody closer together. But I think, to be honest, not every kid is going to look back on all the time at home with a positive feeling about it. Unfortunately, we would have to expect that child abuse, for example, probably did increase all around the country with everybody being quarantined. And what typical reaction do children have to a tragedy? They regress behaviorally, they regress academically. So what does this actually mean for schools? Well, smaller children returning to school might have toileting accidents. Older children may have a lot of difficulty academically, retaining information, concentrating. And kids, like all of us, have problems with worrying about the future and with sleep issues and nightmares. These aren't the unusual reactions for a child. These are pretty much the every single time reaction. And we have to recognize that a number of children will have lost a loved one to the virus. We need to find that out ahead of time. What can we do with our school staff to reach out to all the families and try to find out how children are coping, and hopefully they did not lose a loved one to the virus. But we also have to acknowledge that more children probably than ever before are going to be living in poverty because of the financial hardships. We may have kids that suddenly everybody had to move in with an uncle. We may have kids that are homeless. We may have parents that are actually having trouble just putting food on the table, let alone paying for something like extracurricular sports activities for their child. So regression academically, regression behaviorally. Now, having worked in the schools nearly 30 years, I know that in the fall, we typically reteach key concepts, but we're going to be doing more of that reteaching than ever before. And kids lost out on a lot of things. Their spring activities, for example, getting to make that transition where you actually visited the high school you're now going to be going to and meeting people face to face. And there were dances and sports events and just so many activities. And, you know, I wish as an adult we can make all that disappointment go away, but we can't. Learning to deal with disappointment is part of life. But adults need to be there to really listen. And it doesn't do any good to say, well, let me tell you about a time I was really disappointed. And I can't imagine how hard that is for you, doing all that validation of feelings and letting kids know their sacrifice and a lot of the things they missed in the spring, it did help keep their family and their community safer. So as a crisis responder, one of the main things I do is I listen. To be honest, we as adults often talk way too much. We should be listening to our children and our students, but responding sadly now to 16 different school shootings, there's obviously a point where I need to say a few things, but I phrase that with really a simple question. Who or what has helped you when you've had to deal with something sad or traumatic before? We need to help all school staff. We need to help them first. The analogy I want to give you is a simple one. If you were flying on an airplane as the parent with a small child, and there was a problem with the oxygen level in the cabin of that airplane, whose mouth does that mask go over first? I think you all know. It goes over mom or dad's mouth first. If they pass out, they will not be any help whatsoever to their precious small child. I'm pretty sure you see the analogy here. We got to get input from our staff. We got to meet with them. We have to support them. We have to make them aware of our employee assistance programs. We have to be attuned to, did any staff member lose a loved one to COVID-19? And sadly, a few times, teachers have said to me things like this: I was shot. Nobody from the school even visited me in the hospital. I just got a message saying, be back to school on this day. I did not feel prepared. Now, we have months right now to be preparing, whether it's a mid-August return, whether it's after Labor Day. We have a lot of time. And frankly, there's no excuse for not reaching out to all your staff, getting their input, and doing everything possible to support them. And one of the simplest things I always like to say is everybody needs to seek out the positive people in their life and be that positive person for others. So I thought back on just a couple of examples I want to share with you. The middle school in Houston, where my wife was the principal, got 115 new students as a result of Hurricane Katrina. You got to welcome everybody back. We got to be visible, available. We got to have meetings for parents. We have to welcome their input as we all realize every single kid walking into our schools is somebody's son or daughter, and they deserve our very best. In my large school district in Northwest Houston, we formed a district-wide task force with, of course, school personnel, probably most importantly, parents and community leaders. This would be a time for schools to form that task force. And then one example, where my wife was the principal at a high school, she had 135 homerooms. She met weekly with the school safety representative for every single one of those homerooms. And issues were discussed about school safety at least twice a week, and then a meeting with the principal and everybody. So main point of these examples, involve your staff and students. 2 or 3 people cannot sit in an office today and make all the decisions about how we're going to help everybody with all the psychological aspects of reentry. And we have to realize safety and security for everyone has been threatened. Maslow is the guy that had it right. The pyramid theory, having our physical needs taken care of for food, water, shelter, sense of belonging, those are what have been threatened and will continue to be threatened as we move back to returning large numbers of staff and students to school. So what would be their greatest fear? Catching the virus, of course. And obviously, social distancing, wearing masks, hygiene, cleanliness, staggering our schedules, and not having hundreds and hundreds of kids moving around at the same time in hallways. Those are probably the easiest things to plan. It's like the emotional aspects of all of that are going to be much more complicated. And then, let's be honest, a lot of kids are going to be significantly behind. Some kids, unfortunately, they never really got online to do the virtual learning, or they did it only minimally. And some kids, even if they were online, it just was not a good learning venue for them. We're going to be dealing with a lot of anxiety about catching the virus, also a lot of anxiety about my grades and key skills. And I'm a high school kid and I'm trying to get into an elite college. And there's no easy answer to all of this. It's going to really be about hard work and planning. So I've mentioned a couple of these points earlier, but I want you to see them. And we must find out, did a student or a staff member lose a loved one to the virus? And then obviously reach out and support them. Forming this reentry task force, and many school personnel, teachers have made extraordinary contributions and very creative things. And special ed staff and school psychologists have been working from home and contacting kids and families. So all of those efforts from everybody needs to be recognized and complimented. And we've got to, at a minimum, have some kind of a processing session for our staff. Hopefully all the desks in the circle and administrators being comfortable modeling, expressing a few of their emotions as well. Parents need to be provided the opportunity to give input, but we need to get a letter out. When our committee has determined what our plans are, we got to communicate to the parents through letter, through posting information on the school district website, and helping parents to understand they also must model optimism, hope. This is going to work. I know you want to go back to school. I know they're going to do everything possible to help keep you safe from the virus and help you catch up academically as well. Whenever possible, I'm a big believer in a phone call to families. And could we divide up the entire school and have at least some school staff member reach out individually by phone to every single family? I know that's asking a lot, but what we're dealing with is truly unprecedented in our society. And often after school shootings, when the decision has been made to reopen the school, an open house is held the night before. Kids and their parents have the opportunity to come back, move around in the building, be in a session where they have an opportunity to hear in great detail all the steps that are going to be taken and questions are answered. Now, it occurs to me that that might need to be staggered. If you're a middle school principal, for example, let's have a 6th graders night, then a 7th graders night, then an 8th graders night. And let's try to do this in a way that we follow all the social distancing recommendations. And in consulting with my wife, a former high school principal, would it be possible? Maybe your committee would look at, for high school grades, having the first grading period just simply be pass or fail, given everything that's happened and given the intense pressure on kids today for a super high GPA to get into their state flagship universities. And then we developed a reentry teachable moment lesson plan for classrooms. And Ken Trump has posted that on his website. And if you would like to have these slides available to you, they can also be posted on schoolsecurity.org. So back to the idea of the staff. They've just come in. This obviously a time for them to chat and see other people that they've been isolated from, at least physically, for a considerable period of time. But then let's put the desks in a circle, our chairs in a circle. Let's provide about 20 minutes where people get a chance to talk about what was the quarantine experience like for you and your family. Then we need time allotted to talk about what are your fears and anxiety about coming back today, or about the fact in a couple of days, our students will also be returning to campus. What would help you feel safer? And obviously, we may not be able to implement every one of their suggestions, but in my work, I've really just found that when somebody truly feels heard, when the problem is not just kept inside, but I've expressed it outside to someone else, that simple action often helps a great deal. So what do we want the teachers to do? First and foremost, and I'm just going to say this, we got to keep the politics out of this. This is not a time for somebody to say, I believe our governor or our president did this right or did this wrong. This is not the time for that. It is a time to simply describe and follow the best practices that have been promoted by our leading health experts. For example, the Center for Disease Control. Model calmness and optimism. Hopefully teachers have already reached out to every single student. Now maybe that sounds like a lot, but I'm remembering a suicide cluster that I responded to, and a teacher named Brittany who wrote a personal letter to every single one of 138 students. So I believe reaching out to kids, talking to them prior to their return to school will help alleviate many fears and anxieties. And some kids may not be that concerned about the virus, but I think most of them will be, because frankly, their parents are very concerned. And I always encourage adults not to project all your thoughts and worries about this world onto your 9-year-old child. We want the adults to be very familiar with all the steps that are being taken at Fremont Middle School to help keep you safe. And your principal has welcomed my input. A group of people have met. They've made plans. They're doing everything possible. Now, in the classroom, every student has a story to tell. And obviously, we're going to need to provide the most help to a student who talks about losing a favorite uncle, for example, to the virus. And those that have lost loved ones, we would expect more regression academically from them. Those that had a very difficult time with their parents, and actually school personnel need to be very alert to warning signs of child abuse, because it's gone up before after natural disasters like hurricanes here in Florida, for example, but we've never had such an extensive quarantine in our families. And a number of kids might not have been able to come back to school with all the usual supplies. And schools need to figure out, what could we do to help some of these kids that weren't able to come in fully equipped with their supplies and be maybe more alert than ever before to kids that might actually be homeless. And the kind of problems I've just described, which are very serious, those are the issues that need to be referred to school counselors. So I would simply say to you, I believe school counselors, social workers, school psychologists, they're going to be more needed than ever before in the fall of 2020. Yet I'm really worried that I've heard some examples where those positions are actually being reduced or somebody retired and they're not replaced. But the mental health needs of children at school in the fall of 2020 will be very significant. And one idea I have is there a way to bring back some of the retired counselors, social workers, and school psychologists? Is there a way that maybe some people might even volunteer or might agree to work for a wage that is less than they have normally received? And are there community agencies that might actually put a counselor in your school building for every morning, 3 days a week? So we're going to have to be creative and think about how we can increase the mental health support for our students. And as already mentioned, that Teachable Moment is posted at schoolsecurity.org. And the idea behind it, and we've used this before in different contexts, most notably after 9/11/01, we need a quick, easy, effective way for every student to feel like their voice has been heard, because they too had their safety and security threatened and have been isolated in their homes. So the Teachable Moment is about 6 pages, and I very much hope you will take a look at it and use it in your schools. Now, the bottom line is that working in schools all those years, I know that not every teacher is necessarily that comfortable with, I've got my desk in a circle, now let's talk about what's really been going on in your life with this virus. So that's why the Teachable Moment is so important, because it is scripted. It is step by step. And if you still have teachers that just feel like they cannot implement it, well, those are the classrooms you would send your assistant principal, social workers, counselors, and school psychologists individually. And it may be that under normal circumstances, a teacher would be able to do this quite well, but they're still grieving the loss of their mom who was in a nursing home, for example. So action steps are needed, not only to address the emotional issues, but also to address some of the student anxiety about academics. So we're going to be reteaching maybe more than ever before. And if you're a high school teacher, you're teaching a course that has a prerequisite, for example, but you know in the spring they lost so much in that prerequisite course, you've got to be talking with the instructor for that course and getting the key concepts retaught so you can move forward with your more complicated science course, for example. I heard somebody refer to this as a lost generation academically. I do not believe that. I think with good communication, planning, reteaching, we will not have long-term academic deficits for these kids. But it's going to take a lot of hard work and communication. Most of all, I'm going to say right now, everybody who is listening, take a deep breath, maybe take a couple of them, and basically say aloud, say to yourself, or put it in the chat box, I can manage school reopening. I will be positive and optimistic about this. My voice will be heard by my school administrators. I will take care of myself. And one question I always ask people that have experienced something traumatic: who or what has helped you before? Who or what can help you now? And in my old job, I got pulled into lots of situations where second grade team is really worried about Martha. Martha made statements, pretty upsetting statements about not wanting to live. I'm going to respond. I'm going to sit with Martha if she's willing. I'm going to help her contact a previous counselor, get back on a medication that used to be helpful, talk to her priest at church. But almost always when I would say something like this: Martha, I know things have been really difficult because your partner left you 3 days ago. But prior to that, what did you do that helped you deal with the ups and downs of life? Oh, I'd walk my dog. I would garden. I would call a friend. Well, Martha, have you been doing those things over the last few days? The answer was almost always no. Martha, they're more important right now than ever before. And literally everybody listening today, it's like, we need a self-care plan. Who or what helps you? Who or what can help you be really ready when school resumes for you? And also the reaction of the adults in kids' lives, the teacher, the parent, that has so much to do with how kids are going to respond. And as a teacher, we got to choose here about how much to push about academics. Please remember, your students have gone through a lot, and hopefully this is a time for patience, compassion, kindness, and realizing some of your students aren't going to move as fast as you had hoped in the fall of 2020. And I hope you feel perhaps the greatest sense of connection with the students this fall. It'll take some time, but I'm thinking you will feel more connected to them than maybe any other students in your classes before, because of something everybody went through. What signs could we be looking for student stress? Pretty straightforward: anxiety, worry, fear, feeling on the edge. They might not be eating or sleeping well. And let me make a simple statement. Not getting enough sleep pretty much interferes with our entire being and wellness. We already had a lot of concerns about all the technology. It's under the kid's pillow. The text message wakes them up at 2:30 a.m. We've already had problems with sleep deprivation just because of technology. But when we're worried and we're stressed, somehow I doubt I'm the only person that occasionally, like every third day, I wake up at 4:15 a.m. and it's just like I'm awake. I'm worried about everything that is ahead. Students they may act out more. They may be more irritable than ever before. If they'd had pre-existing issues with behavior problems, well, we would expect those to be exacerbated. And hopefully patience, structure, tolerance, love, consistent responses from the adults at school will help with all of that. We'd also expect some of our older teenagers, if they've used drugs and or alcohol before, they may be very likely to be using them in the fall as well. And be on the lookout for statements about helplessness, hopelessness, and despair. And in a few minutes, I'm going to talk about, there's a lot of concern about the suicide rate in the age of COVID-19. Managing stress. These are pretty straightforward. And I have a simple activity. When I say, Dear Abby, Dear Ann Landers, does anybody remember when there was actually a column in the newspaper, when we read newspapers, where somebody would write in with an issue and Dear Ann Landers or Dear Abby would give them some advice? So what am I actually suggesting here? Ask your older students, adolescents, basically write a letter to a stressed out teenager, a teenager in the age of COVID-19. What can they do to cope? And obviously you hope they know about deep breathing, muscle relaxation, meditation, mindfulness, positive imagery, just believing we will get through this and we can choose how we're going to respond. And I want one of the things that helps me stay in the moment. Let me be honest. I'm teaching 4 classes right now on Zoom. I'm hearing from more people about stress, crisis, suicide, concerns than ever before. And that actually helps me because I'm keeping my brain quite busy. I'm concentrating on what is right in front of me now. Connections are incredibly important. And we're actually very fortunate that we have social networks and platforms like Zoom, where an extended family, our entire class can all be together online. I know it's not as good as being physically in a room or at your house with all your friends, but it is certainly something, and we are lucky to have it. Now, the news, I want to say just a couple of things. Thankfully, the news is better now. But in the early stages, we saw way too many people trapped on cruise ships. We went into way too many overwhelmed emergency rooms. We saw the portable morgues in New York City. And developmentally, small children could not handle that. And I'm going to be honest, I couldn't even handle it as an adult. So we need to all limit the news coverage when they're showing us the most horrific things about the virus and losses. So again, seek out positive people in your life and be that for your students. I've talked about we can't totally dismiss their fears. We need to listen, and we need to honestly acknowledge I've had a lot of those worries too. It's really hard when we're worried about something. There's a lot of uncertainty. We would all like to know exactly when this is going to go away. We'd like to know, when is there a vaccine? When will they be able to test everybody? We do not have those answers. And sometimes as a crisis responder, I've just had to say, it's really hard not to know. It may be a long time before you have those answers. And you may never have those answers to your satisfaction. But what could help you feel just a little bit better now? And kids need a chance to express their emotions through artwork, music, projects, ceremonies, rituals. And like the younger the kid, the more we're talking about poster board and colorful markers, drawings and cards. And we need to emphasize that our school is following all the recommendations to reduce the transmission of this virus. And thankfully, for most Americans, the virus does not have serious or fatal consequences. Even a small child can understand with what it's like to get the flu. And thankfully, for most of us, that's more what the effect of the virus is. And the smartest scientists in the entire world are working on this. And a very productive activity for kids. We got a lot of heroes. They're stocking the shelves at the supermarket. They're the nurses, they're the doctors, they're delivering the food. They're the people that worked all this time to come around and waste management. We need to thank those individuals. So we've got to acknowledge we've never gone through anything like this in our country. The closest thing is the Spanish flu, which was 100 years ago, but we weren't around then. Unprecedented, a lot of uncertainty. And again, there you see the typical reactions that children have to a traumatic event. Adults need to respond with patience, structure, tolerance, love, keep their brains and their bodies busy. I don't think I need to go over these in detail, but just know that I posted for you the typical reactions of a preschooler, an elementary age student, or a high school age student. And let's just zero in on the secondary age. Increased somatic complaints, agitation, apathy, concentration problems. They may be withdrawing from others. They may have increased substance abuse. Resiliency, I'm going to argue it's the biggest word in all of psychology post 9/11/01. It's a very big word right now. It's the ability to bounce back from adversity. It's learned. Probably somebody listening is immediately thinking about somebody that you knew after the traumatic event, like their life was never the same. Maybe they turned to drugs. Maybe they even died by suicide. Maybe they never reinvested in other relationships. But you probably also know people that they went on with their life. They're always going to be sad about what happened, but they did reinvest in other relationships. And this takes a lot of time and effort. And by the way, what are the keys to this learned behavior, resiliency, bouncing back? Being surrounded by loving and caring family and friends. Having the opportunity to vent strong emotions. Using problem-solving skills. And always being optimistic about the future and doing the things that we know are good for us. Those are the keys to resiliency. And when school resumes, we need resilient staff members. We need resilient parents. We need administrators that have truly welcomed the input from kids, school staff, and parents. And we need to implement as many of their recommendations as possible. And what do we need from our teachers? We need them to identify the students that are struggling academically. We need them to identify the students that are suffering from anxiety and fear, or maybe depressed because they lost a loved one, or maybe having great difficulty adjusting to the change in financial circumstances for their family. And we need the administrators being creative and locating the needed mental health support for our students. And as you're thinking about your questions, there have been, frankly, some dire forecasts about suicide rates in the age of COVID-19. Well, here's already some pretty bad news. 2018, suicide rate was at the highest in 50 years in America. The actual number of suicides was the highest ever, more than 48,000. And in particular, suicide is now the second leading cause of death for every kid between the ages of 10 and 17. So who might be the most at risk in the age of COVID-19? Did a staff member or a student lose a loved one to suicide? Did they already have pre-existing mental illness, especially depression? Have they had a dramatic change in finances? We know that suicide rates, unfortunately, have gone up whenever we've had the stock market crash, for example. And essentially, here's the bottom line. We got to talk about suicide prevention more in our homes, our schools, and in our places of worship, especially when you know a kid is the victim of bullying or when they've lost a loved one. We need to ask directly, are you going to be able to get through this? Are you thinking of giving up? Have you actually thought of suicide? We are never going to plant the idea in someone's mind. In fact, when you ask, it actually gives them the opportunity to unburden themselves and realize they are not alone. They're not the first person to feel this way. There is help available, and I will be there for you every single step of the way. This is a time when everyone in our schools needs to know the warning signs: giving away of prized possessions, making out a will, dramatic changes in behavior, statements about death, dying, and suicide, being overwhelmed, statements about helplessness, hopelessness, and despair. And we need everyone in school to be alert and to know the referral procedures. So just a couple of final thoughts. Your behavior is incredibly important. Follow all the recommended guidelines medically. If we truly implement and follow social distancing recommendations, if we wear masks, we can dramatically stop the spread of this virus. And remember, as an adult, your own children and your students, they're looking to you. How are you coping at this difficult time? And as the adult, you've had a lifetime of experiences to draw on when you've gotten through difficult times. Remind yourself every day and with every challenge that you and your students will get through this. So I'm going to turn it back to Ken Trump to see what questions we might have today. Ken, I think you might be muted.
Thank you. You just let me unmute there. Thanks, Scott. Appreciate everyone joining in. I should be back here and we can, Scott, if you want to toss the screen back here.
Sure.
One of the interesting comments in the chat session, thanks, Scott, for a wonderful presentation, as always, very insightful and amazingly on time. I wish I could learn that skill from you because I have a lot of ways to go. For some reason, it's not letting me pick up on the shared screen here, but I do want to acknowledge someone that Scott referred to as we're making this transfer is Dr. Donna Poland, Scott's wife, a veteran school administrator and educational leader who partners along with Scott to create some amazing resources. I put a link in the chat section so that everyone could find that on our articles and resource page, the Teachable Moment. I've shared that with my kids' schools, and the administrators within 3 minutes got back to me and said how valuable that will be as part of their planning for the reentry. This recording today will be on our website, schoolsecurity.org. I'll put the link to it on that home page. But I also want to say that Scott and Donna have created some other resources. I know some people have an interest in the suicide prevention and how suicide issues are impacting schools. Scott, could you briefly share what you and Donna worked on for the state of Montana with the Crisis Action School Kit and how that's available as a resource as well? And then I'll put the wrap up here and point everybody to the next steps.
Yes, thank you, Ken, for mentioning that. And we did what we refer to as the CAST-S, Crisis Action School Toolkit on Suicide for the state of Montana. A hard copy was mailed to every principal in the state. It's available at multiple websites if you just search with CAST-S. And once you get past the cast of the TV program Hannah Montana, you have it. And we also did a similar plan for Texas a few years ago. And a student and I are just completing the Florida Steps School Toolkit for Educators to Prevent Suicide. And those toolkits have about 30 downloadable tools that school personnel are welcome to use, modify in any way they wish.
Okay, I appreciate it. We are interested in hearing about other topics that people would like. This is part 3 of the webinar series. As I mentioned earlier, at schoolsecurity.org, you can find downloads to the session I did last week on communicating to key stakeholders. I deal with the research on ambiguity and uncertainty from my work at Johns Hopkins University for my EDD program that's very applicable at this time. We also have the school reentry planning from an operational perspective webinar that's up as well. A couple of comments from the chat session here very briefly. Mariana mentioned that Indigenous people who have experienced trauma and disease are bringing back those experiences from historical personal experiences to help their communities today to better understand and prepare for what we're dealing with now. And I think that that's something that we can look forward to our elders. Our elders have suffered and experienced and worked through so many tragedies and traumas in their life, from the Great Depression to different types of pandemics. We have a lot of institutional knowledge, sometimes in our own homes and extended families. So I thought that that was very helpful. There are some other questions about the best approach to sharing this information with administrators and getting buy-in at this time. I think the number one thing that I found is that the research shows, and our experience in consulting that we're currently doing with school districts around the country, is that people are frozen. When you get blindsided with a major context of high ambiguity and uncertainty, people freeze in place. The strongest people, from our school leaders and community leaders to those who are on the front line. And when you are overwhelmed with dramatic change and a lot of change and information at the same time, we know that people freeze in place. So we need to start with baby steps. We need to make sure that we are just talking, number one. Number two, we're working to what people are talking to make sure they're asking the right questions. I don't think that anyone has 100% checklist or template. If they do, you are seeing those already starting to pour out by different associations and groups. And we can provide some guidance on the process and the questions, but not everyone has the answers. This is a local group. So start talking. Make sure you have the right people at the table. We've worked with a couple of districts where key positions, key departments are not at the conversation table yet. Facilities is going to be a huge, huge support service and reentry, talking about whether or not we can even get enough hand sanitizer and cleaning supplies and what disinfecting will look like. And many times facilities and operations personnel aren't at the cabinet table or to reentry task force table to come in as one example. We've also found that in the academic side of the house, we've worked with some districts where the executive directors for children with special needs, surprisingly, have not been at the table to talk about what reentry will look like for our many children who have special needs. So I think that we need to start with baby steps, if you will. Make sure, number one, we're getting the conversation started. Number two, we're asking the right questions. And number three, that we have a process to work through to localize the answers and tailor it to our own school communities, because it's clear that the federal government's tossing this to the states. Our states are going to give general guidelines, but I think operationalizing that, it's going to come down to the local schools. Before we sign off, Scott, do you have any final words or reflections?
Well, I want to thank everybody for listening today. And one of the questions was along the lines of, what could you share with your administrators? Well, these webinars are recorded and the Teachable Moment is available. I'm happy to make my slides available. Just see if you can get them to watch one of the webinars Ken has recorded and look at some of the slides, read the Teachable Moment, and start welcoming input.
Thanks a lot, Scott. It's always a privilege. Scott is not only a professional colleague, but a dear friend and one of the people I respect most in my life, and our conversations are wonderful. He and Dr. Donna are amazing people, great human beings, and great contributors to education and the mental health movement in our schools, regardless of what the challenge of the day is. Again, go to our website, schoolsecurity.org. I'm also interested in hearing what other topics you would like to hear, so please email those to me at ken@schoolsecurity.org. Shout out to our large contingent from Alaska today. Again, a great deal of representation from the state level and from the local communities and boroughs and across that beautiful state. And so we appreciate you being a part of this from everyone from Alabama to Alaska today. Thank you. And everyone, stay healthy, stay safe, and thanks for all you do. You are very much appreciated.